Hello, my name is Adelaide here, and I'm gonna be doing the celiac disease for today's assignment. So let's start right away. Alright, so let's start off by what is the celiac disease? Well, it's a gluten, a protein including wheat, barley, and rye, and it's the cause for autoimmune condition celiac disease. So pretty much when a persons with celiac disease consume a gluten-containing meal such as bread, beer, stuff related to that, their immune systems react by attacking the small intestine, damaging the lining and obstructing nutrition absorption. Okay. Going to the second thing, causes of the disorder. Well, there's many, but here we're gonna be. Here's like a handful that may depend on the individual's encounters, because like these are the most common ones, I guess. So, let's start by the genetic predisposition. Some people are more likely to get a celiac disease than others based on their genetic makeup. Which can control the immune system and have a substantial correlations with the illness. Second one would be gluten exposure. As previously established, gluten consumption in patients with a celiac disease causes an immunological reaction and results in the inflammation and damage to the lining in the small intestine, which can be life-threatening, can kill you pretty much. Other medical conditions could be like, for example, a higher chance of having celiac disease is linked to another several medical disorders, including type 1 diabetes, autoimmune thyroid disease, and Down syndrome. And lastly, despite the fact that the stress does not affect celiac disease, it can have symptoms which worse, like have the condition abdominal pain, diarrhea, and other symptoms, which are brought by the gut inflammation, which can be brought by stress. So like stress doesn't isn't like it's not a it's not a it's not an order or a cause from celiac disease, but having stress can like affect the disorder. You know what I mean? But yeah, let's move on to the risk factors. So there's a lot of risk factors, but I only highlighted also the most common ones or like the most important ones I could find. So they are age, family histories, exposure, and disorders. So let's start with age. Age, although celiac disease can be striked at any age, it mostly discovered at patients between 30 years old to 50 years old. So young kids could have it, but it's not likely. Another one would be family history. The likelihood of getting celiac disease if a first degree family, patient, siblings, or kid already has this alignment. So, for example, if I have the disease, I get married and I have kids, the kids could get it. It's a risk factor, pretty much, just like genes. Another one, exposure, long-term gluten consumption can set off a immunological reaction that could result in the celiac disease. And lastly, disorders. The likelihood of getting celiac diseases increases if one autoimmune condition, such as type 1 diabetes, or thyroid illness. Pretty much, if you have diabetes, if you have arthritis or thyroid illness, that could higher the chance of you getting celiac disease, pretty much. All right, let's move on. So there are many symptoms of getting or like knowing you have a celiac disease, but we'll only be covering also what happens like we'll only be covering the most important ones, in my opinion, or I could find also. So one of them is digestive problems, including nausea, vomiting, bloating, diarrhea, and constipation. Another one is skin rash, itchy, blistering rash known as Dimitis herpetiformis. I can't pronounce that right. I'm sorry. And an expected loss of weight of trouble putting on expected loss of weight. You can't put on weight and you can gain weight pretty much. And low on blood cells, which can make you exhausted. You can't breathe well, stuff like that. Another one would be depression, anxiety, impatience, difficulty concentrating on some stuff you could face, and finally joint stiffness and discomfort, which like your joint, your bones, stuff in your body pretty much just hurt you for no reason. you're not going out, you're not moving. Usually they just hurt out of nowhere, pretty much. All right. So the medical and nutrition management method. What can you do to, if you have the disorder? What can you do to like help yourself? Well, you can have a gluten-free diet. You can have nutritional support. You can have monitoring. You can have medications, and you can have support. So let's start with the gluten-free diet, which usually includes avoiding any foods gluten. Like I said, wheat, barley, rye, and some oats is the only effective treatment for garlic disease. This includes numerous pre-seasoned meals, sauces, and condiments, as well as staples like bread, pasta, cereals. You get the idea. Nutritional support. Due to the nutritional loss brought by the intestinal damage in people with garlic disease, these individuals may be nutritionally deficient. So having them trained, having like a trained dietitian can assist you. Like, this is really recommended. Also, if you haven't trained a dietitian, they could pretty much tell you what to eat, what to do, give you a set time, what to do at a perfect time, pretty much, and they can help you out like a lot. It's also recommended by the doctors too. So another one would be medications. In some situations, medications can be required to treat diabetic disease, but it's mostly it's mostly recommended to get a dietitian. You know, gives you stuff to eat, or like when to eat, pretty much. Another one would be monitoring. Osteoporosis, anemia, and various types of cancer are among the consequences that are most common in people with garlic disease. Frequent screening and monitoring can aid in early detection of these problems and can prevent management. And finally, support. Support is recommended, but it's not needed. Pretty much, support is like you go find people with the same disorder you have, and you share like what you're struggling with, what you need help with, and you can pretty much like connect the dots, help each other out. And I believe finally we have the long-term effects of the disorder. So there's a lot of actually long-term effects I found out, but these are the most important, also in my opinion, and other people's opinions. So let's start with the first one, which is the dental enamel defects. Pretty much, children with the colic disease might alter the way their teeth look and work. So they can like go sideways. They don't function well. Pretty much something like that. Malnutrition. Small intestine damage from colic disease can impair nutrition absorption and result in malnutrition, which can be pretty dangerous. Intestinal cancer. Although it is uncommon, colic disease can raise the chance of getting intestinal cancer if untreated or inequality managed. Pretty much says it's so. This intestinal cancer is really, really rare, but it's never zero. So even though you can't get it, or there's a small chance you can get it, but it's never zero. So you should still be careful. And another one would be neurological problems. Some people experience high risk of neither neuropathy or seizures, like we said before. Just gotta pay attention to what you eat, what you do. And finally, the osteoporosis. Again, we said this. The individuals have weaker and brittle bones if they don't get the right nutrition. But yeah, that's really about it. And that all you need to do is pretty much pay attention to what you eat, what you do, how you react to stuff, what you have to do every day in your everyday life. And yeah, it's not a big thing. It's kind of like diabetes in a way. You gotta like pay attention to what you eat, what you do, how you physically do stuff, and you should be good. But yeah, that's about it. Thank you for listening to me, and hope you have a good day.